Most seniors take their blood pressure medication faithfully, but quietly run low on 5 specific minerals that help that medication actually work. Here is what the research shows. What if lowering your blood pressure did not have to mean adding another pill to your morning routine? That is a question a lot of people over 60 are quietly asking. And it is a fair one. You are already taking your medication. You are already watching your sodium. You are already doing what your doctor told you. And yet your systolic number, that top number on the blood pressure reading, keeps sitting higher than you would like. Here is something worth knowing. There is a group of 5 minerals that research has consistently shown may support meaningful reductions in systolic blood pressure, in some studies by 15 to 20 points over time, when added thoughtfully to the diet. Not supplements you have never heard of, not exotic ingredients. Minerals your body already knows how to use. The interesting part is not that these minerals exist. It is that most seniors over 60 are not getting enough of them, often without realizing it. And that quiet shortfall may be one of the reasons blood pressure stays stubborn despite medication and effort. I want to be clear before we go further. I am not suggesting you stop your blood pressure medication. That is a conversation for you and your doctor. What I am sharing today is information about nutritional support that may work alongside what you are already doing. Think of it this way. Medication is like the foundation of a building. These minerals are like the walls and the roof. The foundation alone keeps things standing, but the complete structure is stronger. Stay with me, because the 5th mineral is one almost nobody talks about, and it may be the most important one of all. Let me start with what I see in my practice. Patients come in with blood pressure that is technically controlled, sitting at 138/85 or 142/88, close to target but not quite there. And they want to know if there is something else they can do. When I review what they are eating, the pattern is almost always the same. Very little magnesium, low potassium, minimal calcium from the right sources, no attention to CoQ10, and 0 awareness of the 5th mineral we will discuss shortly. These are not dramatic deficiencies. They are quiet insufficiencies that accumulate over time and may gradually make blood pressure harder to manage. Have you had your magnesium level checked recently? Most routine blood panels do not include it, and that is part of the problem. The first mineral is magnesium. Magnesium may be the single most underappreciated mineral in cardiovascular health. Your blood vessels are surrounded by smooth muscle. When that muscle is tense, it squeezes the vessel wall and blood pressure goes up. When it is relaxed, the vessel expands slightly and pressure comes down. Magnesium acts as a natural muscle relaxant. It helps the smooth muscle surrounding your blood vessels stay in a more relaxed state. When magnesium levels are adequate, blood vessels tend to be more flexible and responsive. Multiple studies have found that adults with higher dietary magnesium intake tend to have lower systolic blood pressure. A review of randomized controlled trials found that magnesium was associated with systolic blood pressure reductions, particularly in people who were deficient to begin with. The challenge is that magnesium deficiency is extremely common in adults over 60. Many blood pressure medications, particularly diuretics, increase magnesium excretion through the kidneys, and older adults absorb magnesium less efficiently than younger adults. Here is what this means practically. You might be taking your blood pressure medication faithfully, and that medication might be quietly depleting the very mineral that could help your pressure respond better. This is more common than most people realize. The best food sources of magnesium are dark leafy greens, particularly spinach and Swiss chard, pumpkin seeds, almonds, black beans, and whole grains like quinoa and brown rice. 1 cup of cooked spinach provides approximately 157 milligrams of magnesium. An ounce of pumpkin seeds provides about 168 milligrams. The recommended daily amount for adults over 60 is around 320 to 420 milligrams. If getting that from food consistently is difficult, magnesium glycinate or magnesium malate are well-tolerated forms worth discussing with your doctor. The second mineral is potassium. Potassium and sodium are in constant balance inside your body. Sodium causes fluid retention and raises blood pressure. Potassium helps the kidneys excrete sodium, counteracting its pressure-raising effect. When potassium intake is adequate, your kidneys are better equipped to flush excess sodium out. Blood volume decreases slightly. Vessel walls face less pressure. Systolic numbers tend to respond. The DASH diet, specifically designed by researchers to lower blood pressure through nutrition, is built heavily around high potassium intake. Studies following the DASH pattern have shown systolic reductions of 8 to 14 points in people with hypertension. The best food sources are sweet potatoes, white potatoes with skin, white beans, lentils, spinach, avocado, salmon, and bananas. One medium sweet potato provides about 542 milligrams of potassium. 1 cup of white beans provides over 1,000 milligrams. The general target is 3,500 to 4,700 milligrams per day, an amount most Americans fall significantly short of. One important note here, if you're on an ACE inhibitor or ARB, like lisinopril or losartan, these medications already cause some potassium retention. Dramatically increasing potassium through supplements is not recommended without talking to your doctor first. Food sources at normal dietary amounts are generally safe. Supplements require guidance. Have you been getting enough potassium-rich foods regularly? This is a simple thing to track and improve starting this week. The third mineral is calcium. Calcium and blood pressure have a relationship worth understanding clearly. Calcium plays a role in how strongly blood vessel walls contract. This is actually how a class of blood pressure medications called calcium channel blockers works. They block calcium from entering vessel muscle cells, causing vessels to relax. Adequate dietary calcium, not supplement megadoses but regular food amounts, is associated with lower blood pressure in multiple population studies. The best food sources for seniors are low-fat yogurt and milk, fortified plant milks like almond or oat milk, canned salmon with bones, edamame, and white beans. 1 cup of plain yogurt provides approximately 415 milligrams of calcium. The recommended daily amount for adults over 60 is 1,200 milligrams. Worth noting, calcium from food appears to have different effects than calcium from high-dose supplements. Getting this mineral primarily from food is generally the preferred approach. Your doctor can guide you if supplementation seems appropriate. This is where it gets interesting, because the next 2 minerals are ones most people have never associated with blood pressure at all. The fourth is CoQ10. CoQ10 is a compound that exists in every cell of your body. It is essential for energy production, particularly in high-demand organs like the heart. Your body produces CoQ10 naturally, but production decreases significantly with age. And here is something many people do not know. Statin medications, among the most commonly prescribed drugs for cholesterol, substantially reduce the body's production of CoQ10. Many seniors over 60 who are on statins may have meaningfully lower CoQ10 levels as a result. Multiple studies have found that CoQ10 supplementation may help reduce systolic blood pressure. One meta-analysis found reductions of up to 17 millimeters of mercury in systolic pressure among some participants. The mechanism appears related to CoQ10's antioxidant effects on blood vessel function, specifically its ability to support the endothelium, the inner lining of blood vessels that controls how they expand and contract. CoQ10 is difficult to get in meaningful amounts from food alone. The best dietary sources are fatty fish, organ meats, and beef. Supplemental doses typically range from 100 to 300 milligrams daily. The form called ubiquinol is generally better absorbed than the more common ubiquinone form. If you are on a statin and have not discussed CoQ10 with your doctor, this conversation may be worth having at your next visit. Are you on a statin right now? If so, CoQ10 is something worth considering. And now the fifth mineral, the one most people have genuinely never heard of in connection with blood pressure. It is called taurine. Taurine is an amino acid that also functions as an important regulatory compound in cardiovascular health. It is found naturally in meat, fish, and dairy. Here is why taurine matters for blood pressure. Taurine helps regulate how cells manage calcium and sodium. It supports the kidney's ability to excrete sodium. It has antioxidant effects on blood vessel walls, and it appears to modulate the sympathetic nervous system, the part of your nervous system that raises blood pressure in response to stress. Several clinical studies have found that taurine supplementation was associated with meaningful reductions in blood pressure. One study published in the American Journal of Clinical Nutrition found that participants who took 1.6 grams of taurine daily for 12 weeks experienced systolic blood pressure reductions of about 7 millimeters of mercury compared to placebo. That is a modest but real and consistent effect from a single nutritional compound with an excellent safety record. The best food sources of taurine are shellfish, particularly scallops and clams, dark poultry meat, beef, and dairy. Taurine as a supplement is generally well tolerated. As always, mention any new supplement to your doctor or pharmacist first. This is where the picture really comes together. None of these 5 minerals works in isolation. They interact with each other and with your existing medications and with your overall diet. The goal is not to replace medication. It is to create an internal environment where your cardiovascular system has every nutritional tool it needs to function well. Let me give you a simple daily summary. Every day, aim for at least 2 servings of dark leafy greens. Spinach or Swiss chard cover both magnesium and potassium together. Every day, include 1 potassium-rich food, a sweet potato, a serving of white beans, half an avocado, 3 to 4 times per week. Include a calcium-rich food, yogurt with breakfast, canned salmon with lunch, fortified oat milk with dinner. If you're on a statin, discuss CoQ10, ubiquinol with your doctor. And consider asking about taurine, particularly if your systolic pressure has been stubbornly high despite medication and dietary changes. Small adjustments like these, done consistently over weeks and months, can meaningfully support your blood pressure alongside your medication. This is not about dramatic overnight transformation. It is about giving your heart and blood vessels the nutritional foundation they need to respond better to everything else you are already doing. You deserve to know about these options, and now you do. If you found this helpful, I've linked another video here covering specific meal patterns associated with lower blood pressure. It gives you a practical structure to work with. Please share this with someone over 60 who is managing blood pressure. Subscribe to Golden Healthy Years for honest health guidance made specifically for people over 60. Take care of your minerals, take care of your heart, and take care of yourself.